Hello, my friends in India. How are you doing? This is our second episode, and I will take this a little bit forward and give you a little idea how the healthcare industry works in United States. So इस एपिसोड में हम बात करेंगे कि यूनाइटेड स्टेट्स में हेल्थ केयर इंडस्ट्री जो है वो किस तरह से आप लोगों के लिए अपॉर्चुनिटी पैदा कर रही है, किस तरह से ग्लोबल वर्कफोर्स या पीपल फ्रॉम इंडिया दे कैन बी अ पार्ट ऑफ इट जस्ट बाय सिटिंग इन इंडिया. And that is the main thing. You guys have to understand when you start working for a BPO company that this is not just any regular call center job. When we are talking about BPO and especially healthcare BPO, you are dealing with somebody's health and you are dealing with somebody's life and death. And when it comes to the question of life and death, just think from your own perspective, how would you feel when you go to the hospital by yourself and you get a bill of $10,000 or $20,000, and next thing you know is insurance company is not paying for that bill and you have to pay from your pocket. So think from that perspective. If there's something goes wrong in it, or your doctor has to go back and forth, or if your doctor do not get paid, how would he feel about it? So इस industry में तीन लोग बहुत important हैं. There are three very important yardsticks or three people who define the medical healthcare industry in United States. One is a doctor, and of course it's the same in India. In India also the doctor is very important. The second is patient, who is the super important. He is the main driver. And then the third thing, which is driving both patient and provider, is called insurance company. So you have a doctor who is called provider, which is not just doctor. It can be a hospital, it can be a free medical emergency clinic, a walk-in clinic, or a doctor's office where you can go, schedule an appointment, go and see him. The another thing, which is also very important, which acts like which is also a provider, is called outpatient clinics, where a person is treated in less than 12 hours. He gets minor surgeries and he gets to go home after the surgery. So especially when you talk about the provider side, you have to understand that the provider is not just a doctor. Provider means all of these four people. ये जो मैंने आपको बताया, इसमें हॉस्पिटल भी हो सकता है, आउटपेशेंट क्लिनिक भी हो सकती है, सर्जरी सेंटर होता है, स्मॉल क्लिनिक, वॉक इन क्लिनिक, इमरजेंसी सेंटर, chiropractor center, any place where services are rendered, it is called provider. It can be MDs, it can be non-MDs, but they should have some kind of degrees. So this is a provider side. The second is patient. Patient is patient. Patient is like just in India, everybody who goes, who gets the service is patient. Especially in the United States, दो चीजें आपको समझनी बहुत जरूरी हैं. Two things are very important. One, what kind of patient you are. What that means is what kind of insurance you carry. So पहले हम patient को समझते हैं, उसके बाद में हम insurance company को समझेंगे. So patient has an insurance tied to him. He buys, he goes out in the market. So like in 2014, there is a law, Obamacare, which became very popular, which was launched. And Obamacare की जो condition थी वो यही थी कि there would be a lot of people who do not have insurance in the United States. They would get insurance through Obamacare marketplace. So when that launched, it became virtually a boon to all kind of patients who did not have insurance earlier, now have insurance. Of course, Obamacare the way Obamacare worked is it basically small businesses got a little bit of pinch of some extra cost in their budgets towards the employee side, but ultimately it helped the patients. So patients दो या तीन तरह के होते हैं, but widely you have to understand there are three types of patients. One, those who are on Medicare. They are age 60 and above. Second, patients who have group health insurance or personal health insurance or commercial insurance, which they buy either from their pocket or they buy through their employer. Most insurances are through the employer if the patient is young, they have a family. 70-80% of the time the insurance is covered by the employer. Means just like your company, you're working in a company in India, and if your company buy a private insurance for you and they cover the 70% or 60% or 50%, whatever the cost it is, that is another type of insurance or another type of patients you have. The third type of patients is people who can't afford insurance, and they are basically on Medicaid. So Medicaid is a popular program of government where they provide coverage for those patients who do not have any active insurance policies or who cannot afford to pay for their own insurances. Because remember one thing, any insurance you buy, somebody has to pay for it, like for the premium. Just like you pay for the premium for your life insurance, for your auto insurance, for any kind of insurance. I'm sure in India also it's the same way. You have any kind of insurance, you pay a monthly premium or an annual premium. It's the same way somebody has to pay for the healthcare insurance premium. So Medicare is a mandatory program by the government, so until you are employed, a certain percentage of your salary portion goes towards the Medicare, which gets deposited. So once you qualify for Medicare program, you start receiving the benefits of it. Until you have that qualification kicks in, you have to buy a commercial insurance or some insurance. You have to go through your group plan or your employer, or you have to buy it from your pocket. So on an average, above these three type of patient, there's a fourth category which is called the self-pay patient, which is like people who do not want to have an insurance and they just pay from their own pocket, any kind of self-pay patient. So these are the broad categories of the patients. Now we talk about the insurance companies. So when I was explaining you the patient, I also explained you what kind of insurance companies are available, right? So 50%, 40 to 50% population, like especially in Florida, is about Medicare population. But it depends on a state to state, population differs. But Medicare is a big payer, which is a government agency, government plan, and they have the standard fee rates. We'll talk about other things in the next episode, but first you understand the perspective. What I'm coming from is these three players. So we talked about patient, we talked about provider. Now I'm talking about insurance companies. Medicare is a government agency. Commercial insurance is the private players like United Healthcare, Aetna, Cigna. जितने भी नॉन मेडिकेयर प्रोवाइडर्स हैं, कमर्शियल प्रोवाइडर्स, इन लोगों का खुद का फी स्केड्यूल होता है. They are private payers. You can buy these commercial insurances by paying from your pocket, or as I said, your employer will pay for it. The third category, the third one is so you have a commercial, you have Medicare, and then a Medicaid. So Medicaid, I spoke to you earlier also, it's a government program for those who can't afford to have insurance. Now all those three things which I described are linked through one thing, and that one thing is, this form. This form is called CMS 1500 form, and this is a paper form which I'm showing you, but it has about 33 fields. You see, it has about 33 fields which are very important to learn. So if you are trying to become the best biller or medical biller, this is my humble request to you, and humble, why I call it a humble request, because most training programs fail when they don't teach these 33 fields, or they don't explain about these 33 fields and the mission behind processing this claim form. Because all these three important players I explained, patient, provider, insurance company, they cannot talk to each other if this form is not a link between them. So किसी भी insurance का payment reimbursement to get that reimbursement पाने के लिए, you have to fill this form, and people who fill this form is the billing companies. This is our job. This is your job. And that's what we do. We fill out these 33 fields correctly, and we process this to the insurance company so that insurance company can send the payment to the doctors. So again, try to understand what I'm explaining to you. It is very important for you guys to look here, see, ask for this form from wherever the company you are working. You need to train yourself, train your eyes to look through from 1 to 33 each field. Now it can be paper-based, it can be digital, it is in a software format. There are thousands of softwares available in the market which you use or your company uses for billing process. Every company has the same format. Every insurance company uses the same CMS 1500 format, which is developed by Medicare CMS, Center for Medicaid Study. This, if you understand this form very well, you would be the fantastic medical biller. No matter whether you are in India, you are here in United States, आप कहीं चले जाइए, आपको ये फॉर्म और इसमें लिखे जितनी चीज़ें हैं ये सारी समझनी पड़ेंगी, अंडरस्टैंड करनी पड़ेंगी, लर्न करनी पड़ेंगी. Once you develop this skill set, you would be a fantastic medical biller, I can promise. And in the next episode, I'm going to talk about these things. But I hope today's episode about this entire medical billing and coding and about the 3 things what we talked about: patient, payer, and provider. 3 P's: patient, payer, and providers. Remember 3 P's. I will look forward for your comments in the next episode, and I look forward to hearing from you more about these. Thank you very much. Have a wonderful day.